Hello everyone and welcome to today's video. In this video, we will be discussing a topic that affects millions of people all around the world: brain disease. Our brain is one of the most complex organs in our body, controlling all of our thoughts, actions, and emotions. When something goes wrong with our brain, it can have a profound impact on our lives. So, let's dive into the world of brain diseases and learn more about them. Brain diseases can be classified into various categories depending on the specific area of the brain that is affected. One common type of brain disease is neurodegenerative diseases. Neurodegenerative diseases, such as Alzheimer's and Parkinson's, are characterized by the progressive degeneration of nerve cells in the brain. This leads to a decline in cognitive function, movement problems, and in some cases, behavioral changes. These diseases often have no cure, but there are treatments available to manage the symptoms and slow down the progression of the disease. The brain is an incredibly complex organ that controls all aspects of our physical and mental functioning. Brain diseases can disrupt these critical functions, leading to significant challenges and difficulties for those affected. In this presentation, we'll explore some of the key brain diseases, how they impact individuals, and potential treatment approaches. The brain's intricate network of neurons and pathways is what enables us to think, move, and experience the world around us. Understanding the complexity of the brain is crucial to addressing the various diseases and disorders that can arise. The brain is the control center of the body, responsible for our thoughts, feelings, and movements. It's divided into three main parts: the cerebrum, cerebellum, and brainstem. The cerebrum is the largest part and handles higher-level functions like language, memory, and reasoning. The cerebellum at the back of the brain coordinates movement and balance. The brainstem connects the brain to the spinal cord and controls essential functions like breathing and heart rate. This detailed 3D illustration gives a clear visual representation of the brain's anatomy and the key regions. Genetics play a key role in many brain diseases. Certain genetic mutations can be passed down and cause issues with brain development or function. Environmental factors like exposure to toxins, viruses, and traumatic brain injuries can also contribute to brain diseases. Lifestyle choices around diet, exercise, and habits like smoking can impact brain health. Maintaining a healthy lifestyle helps reduce disease risk. As we age, the brain becomes more susceptible to diseases like Alzheimer's. This is an important consideration, especially for older adults. Neurodegenerative diseases like Alzheimer's, Parkinson's, and Huntington's involve the progressive loss of brain cells and function over time. Vascular diseases in the brain, such as stroke or vascular dementia, are caused by problems with the blood vessels. Brain tumors are abnormal growths of cells in the brain that can cause a variety of symptoms depending on their location and size. Seizure disorders are characterized by abnormal electrical activity in the brain, leading to seizures that can vary in severity and frequency. Alzheimer's disease, an increasingly prevalent neurodegenerative disease that affects millions of people worldwide. Alzheimer's disease is a complex condition that primarily affects the brain, leading to memory loss and cognitive decline. In this video, we're going to explore the causes, symptoms, and potential treatments for this devastating disease. Let's start by discussing the causes of Alzheimer's disease. While the exact cause of this condition is still unknown, researchers believe that a combination of genetic, lifestyle, and environmental factors contribute to its development. Genetic factors, such as certain gene mutations, can increase the risk of developing Alzheimer's. Additionally, age, family history, and certain health conditions like diabetes or high blood pressure can also increase the likelihood of developing the disease. Moving on to the symptoms of Alzheimer's disease, it's important to note that these symptoms can vary from person to person. In the early stages, individuals may experience mild forgetfulness, trouble concentrating, and difficulty finding the right words. As the disease progresses, memory loss becomes more severe, and individuals may struggle with everyday tasks like dressing or using everyday objects. Personality and mood changes, confusion, and difficulty recognizing familiar faces are also common symptoms. The image on this slide shows a close-up view of the brain, highlighting the amyloid plaques that are a hallmark of the disease. The disease is characterized by the buildup of abnormal proteins in the brain, which disrupt communication between brain cells. This leads to the progressive decline in cognitive functions that we see in Alzheimer's patients. These plaques interfere with normal brain cell activity and contribute to the symptoms of Alzheimer's. Understanding the underlying biology of Alzheimer's is crucial for developing effective treatments and interventions. Parkinson's disease is a progressive neurological disorder that affects movement. Key symptoms include tremors, slow movements, stiffness, and impaired balance. As the disease progresses, people may have difficulty with everyday tasks like walking, talking, and daily activities. This is caused by the loss of dopamine-producing neurons in the brain region that controls movement. While there is no cure, treatments like physical therapy, medication, and support groups can help manage symptoms and improve quality of life. A stroke is a serious medical emergency caused by a blockage or rupture in a blood vessel in the brain, which cuts off oxygen supply to brain tissue. Stroke symptoms can develop very quickly and vary depending on the location and severity of the problem, but often include sudden difficulty with speech, vision, movement, or balance. Immediate medical attention is crucial to diagnose the type of stroke and provide appropriate treatment, as this can minimize permanent brain damage. Rehabilitation and therapy are essential for stroke patients to regain lost functions and improve their quality of life after the initial medical emergency. Traumatic brain injury, or TBI, is a serious health issue that affects many people, especially children and young adults. It's caused by a blow, bump, or sudden rotation of the head, which can lead to damage and disruption of normal brain function. TBI is a leading cause of death and disability in the U.S., so it's an important topic to understand. The image on this slide depicts a graphic and chaotic scene of a person who has suffered a severe head injury, likely from a fall or accident. This visual helps convey the serious and often devastating nature of TBI and the need to take it very seriously. As I discuss this topic, I'll highlight the key causes, impacts, and importance of addressing traumatic brain injuries. Brain tumors are abnormal growths of cells in the brain. They can be cancerous, malignant, or non-cancerous, benign. Symptoms vary depending on the location and size of the tumor. Common symptoms include headaches, seizures, vision problems, and changes in personality. This 3D illustration shows a large, colorful tumor growing on the surface of the brain, highlighted by a bright light. Epilepsy is a neurological disorder that causes recurrent seizures, which are the result of abnormal electrical activity in the brain. Seizures can vary greatly in severity and frequency, from brief and subtle to prolonged and severe. Epilepsy can affect people of all ages, so it's an important condition to understand. The dramatic image on this slide depicts the intense and disruptive nature of a seizure, with a blurry, strobe-like effect conveying the loss of control and disorientation experienced. This slide provides an overview of what epilepsy is and the key characteristics of seizures, setting the stage for a deeper discussion of this condition. Multiple sclerosis is a chronic disease that affects the central nervous system. It can cause a range of symptoms, including muscle weakness, fatigue, and difficulty walking. Numbness and tingling, often in the hands, feet, or face, are also common. Vision, balance, and coordination can also be affected. While there is no cure for MS, there are treatments available to help manage symptoms and slow disease progression. These include medications, therapies, and lifestyle changes. Huntington's disease is a rare, inherited neurological disorder. It causes progressive degeneration of nerve cells in the brain. Symptoms include involuntary movements, cognitive decline, and psychiatric problems. The disorder typically begins in midlife and worsens over time. There is no cure, but treatments are available to manage the symptoms. The image shows a close-up of a person with Huntington's disease, with a sad, realistic expression under soft lighting. ALS is a devastating neurodegenerative disease that affects the motor neurons responsible for voluntary muscle movement. It leads to progressive muscle weakness, atrophy, and eventual paralysis, impacting speech, swallowing, and breathing. While there is currently no cure for ALS, treatments are available to help manage symptoms and improve quality of life. Ongoing research is exploring potential new therapies and a cure to provide hope for ALS patients and their families. It's a complex and challenging condition, but advancements in understanding and care are being made through continued scientific investigation. Frontotemporal dementia, or FTD, is a group of brain disorders that affect the frontal and temporal lobes. This leads to problems with behavior, language, and personality. Symptoms can vary depending on the specific type of FTD. While there is no cure, there are treatments that can help manage the symptoms. The image shows a doctor having a warm, gentle conversation with a patient. This represents the importance of care and support for those living with FTD. A Lewy body dementia is a progressive brain disorder that affects thinking, movement, behavior, and sleep. It's caused by the buildup of abnormal protein deposits, called Lewy bodies, in brain cells. The symptoms can be similar to Alzheimer's and Parkinson's disease, but the progression and severity can differ. The image shows a close-up portrait of a person with LBD, with a furrowed brow, confusion, and a slightly vacant expression. The soft, natural lighting emphasizes the wrinkles and subtle changes in their eyes, adding a sense of weariness. Vascular dementia is a type of dementia caused by damage to the blood vessels in the brain, often due to stroke or chronic conditions like high blood pressure. The severity can vary depending on the extent of brain damage. Symptoms may include memory loss, confusion, difficulty with planning, and changes in mood and behavior. The symptoms can progress gradually, with periods of improvement and decline. This unpredictable nature makes vascular dementia challenging to manage. The image shows a detailed illustration of a brain with the damaged blood vessels highlighted in red, providing a visual representation of the vascular damage that leads to this type of dementia. Brain diseases can impact cognitive abilities like memory, thinking, language, and judgment. These cognitive difficulties can vary in severity and may significantly impact daily life. Motor problems are common, ranging from tremors to difficulty with movement, coordination, and balance. Brain diseases can also affect the senses, including vision, hearing, and touch, potentially leading to hallucinations or distortions of reality. Emotional and behavioral changes are possible, such as mood swings, anxiety, depression, and personality shifts, which can impact relationships and overall well-being. It's important to be aware of the wide range of symptoms that can occur with brain diseases, as they can profoundly affect a person's functioning and quality of life. A thorough medical history helps identify potential risk factors and symptoms, as well as any underlying conditions that may be contributing to the patient's brain health. The physical exam assesses the patient's overall health and neurological function, looking for any signs of impairment or abnormalities. The neurological examination tests the patient's reflexes, coordination, balance, and mental status to evaluate brain function and identify any specific neurological deficits. Advanced imaging techniques like MRI and CT scans can visualize the brain structure and detect any abnormalities such as tumors, strokes, or other lesions. Neuropsychological testing assesses the patient's cognitive abilities, memory, language, and attention to identify specific cognitive deficits associated with brain diseases. Laboratory tests on blood and cerebrospinal fluid can help detect infections, inflammation, or metabolic disorders that may be affecting the brain. Genetic testing can identify mutations linked to certain brain diseases, which can aid in early diagnosis and management of the condition. MRI uses magnetic fields and radio waves to create detailed images of organs and tissues, which is helpful for identifying brain tumors, strokes, and other neurological conditions. CT scans use X-rays to create cross-sectional images of the brain and can detect bleeding, bone fractures, and other abnormalities. PET scans use a radioactive tracer to show how the brain is functioning and can be used to detect Alzheimer's disease and other conditions. EEG measures electrical activity in the brain using electrodes placed on the scalp and is used to diagnose epilepsy and other neurological disorders. Neuropsychological testing is a valuable tool for evaluating cognitive abilities like memory, attention, language, and executive function. These assessments help identify specific areas of impairment, which is crucial for accurate diagnosis and effective treatment planning. Tests like the MMSE and MoCA are commonly used to screen for cognitive decline and conditions like dementia. The results from neuropsychological testing provide important insights that guide diagnosis, inform treatment decisions, and monitor the progression of brain diseases over time. This comprehensive approach allows healthcare providers to develop a deeper understanding of the patient's cognitive profile and tailor interventions accordingly. Genetic testing is a powerful tool that can help identify genetic predispositions to certain brain diseases. By understanding their genetic risk factors, individuals can make informed decisions about lifestyle changes and preventive measures to potentially reduce their risk. Genetic testing is also crucial for diagnosing rare brain disorders with a known genetic basis. Confirming a genetic diagnosis helps guide treatment and provides valuable genetic counseling for the patient and their family. Treatment options for brain disorders can be divided into several key categories. Medications, various drugs that can help manage symptoms and slow disease progression. Surgical interventions, procedures performed by skilled neurosurgeons to remove tumors or relieve pressure. Rehabilitation therapies, physical, speech, and occupational therapies to help patients regain lost skills and improve function. Lifestyle changes, adopting a healthy lifestyle, including diet, exercise, stress management, and sleep, can positively impact brain health. Medications can play an important role in managing the symptoms of brain diseases, such as pain, seizures, and cognitive issues. Some medications have the potential to slow the progression of certain brain diseases like Alzheimer's and Parkinson's. Treating any underlying conditions that contribute to brain disease, like high blood pressure or diabetes, can also be an important part of the treatment approach. The best medication regimen will be highly individualized, taking into account the specific disease, symptoms, and other health factors for each patient. It's critical to work closely with healthcare providers to determine the most appropriate medications and dosages to meet the unique needs of each individual. Surgical interventions are an important part of neurosurgery, allowing us to directly access and treat various brain conditions. A craniotomy involves opening the skull to access the brain, which can be used for tumor removal, blood clot removal, or to relieve pressure. Stereotactic radiosurgery uses focused beams of radiation to precisely target and destroy brain tissue, often used for tumors, AVMs, and trigeminal neuralgia. Deep brain stimulation involves implanting electrodes in specific brain regions to regulate electrical activity, which can be helpful for conditions like Parkinson's, essential tremor, and dystonia. These interventions demonstrate the advanced techniques neurosurgeons can employ to directly address complex neurological issues. Rehabilitation therapies are essential for helping individuals recover and regain independence after an injury, illness, or disability. Let's take a closer look at the four main types of rehabilitation therapies: physical therapy, occupational therapy, speech therapy, and cognitive rehabilitation. Physical therapy focuses on improving physical function, reducing pain, and increasing mobility through exercises and techniques that build strength, balance, and coordination. Occupational therapy concentrates on helping individuals relearn and regain independence in daily living activities like dressing, eating, and using the bathroom. Speech therapy addresses communication difficulties, working on speech production, swallowing, and language comprehension. Cognitive rehabilitation aims to improve thinking, memory, and problem-solving skills for those with cognitive impairments. Each of these therapies plays a crucial role in the rehabilitation process, helping individuals regain their abilities and quality of life. A healthy, balanced diet rich in fruits, vegetables, and whole grains can support brain health. It's important to reduce processed foods, saturated fats, and sugar. A regular physical activity improves blood flow to the brain, promotes cell growth, and reduces inflammation. Aim for at least 30 minutes of moderate-intensity exercise most days of the week. Adequate, restful sleep allows the brain to repair itself and consolidate memories. Strive for 7 to 8 hours of quality sleep each night. Chronic stress can damage brain cells, so it's important to practice relaxation techniques like deep breathing, meditation, or yoga to manage stress. Caring for someone with a brain disease can be emotionally challenging, so it's important for caregivers to seek support from therapists, support groups, and online communities. Caregivers may need practical assistance with daily tasks like cooking, cleaning, and transportation. Explore respite care programs or hire in-home help. Caregiving can be financially draining, so caregivers should explore government assistance programs and support organizations that provide financial aid. Caregivers may need legal advice regarding power of attorney, guardianship, and end-of-life decisions. Consult with an attorney specializing in elder law. Clinical trials are essential for developing new therapies and treatments for brain diseases, providing evidence-based data that can lead to breakthroughs. Research aims to identify biomarkers and diagnostic tools for early detection, allowing for timely intervention and potentially slowing disease progression. Scientists explore the underlying causes and mechanisms of brain diseases through research, paving the way for more targeted and effective treatments. Research focuses on improving the quality of life for individuals living with brain diseases by developing strategies to manage symptoms and support caregivers. A healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking and excessive alcohol, can reduce risk factors for brain diseases. Regular medical checkups, screenings, and early diagnosis are important for improving outcomes and potentially preventing worsening of brain diseases. Genetic testing and counseling can identify individuals at higher risk for certain brain diseases, allowing for proactive management and potentially preventative measures. Reducing exposure to environmental toxins and traumatic head injuries can also contribute to brain health and disease prevention. Patient organizations provide vital resources, support, and advocacy for patients, caregivers, and researchers. Healthcare professionals like neurologists and neurosurgeons offer comprehensive care, including diagnosis, treatment, and ongoing management. Support groups allow patients to connect with others facing similar challenges, providing emotional support and coping strategies. Clinical trials offer opportunities for patients to access new treatments and contribute to scientific advancement. Thank you for watching our video today. If you found this information useful, be sure to give this video a thumbs up and subscribe to our channel for more informative content. Take care, and we'll see you next time.